Emergency signs in sick children, every parent should know. Every minute in a child's life depends on it. So, imagine your child gasping for air at 2 a.m. Would you know what to do? Many parents don't until it is too late. Let's change that. And this is why we have this talk. I'm Dr. Joshua Nderitu, a family physician. I have interest in public health affairs and also cancer prevention and treatment. Why does it matter for parents to know some of the emergency signs in sick children? This is why it is important. Over 5 million children die every year from preventable causes. We need to change this. Most parents miss the early warning signs of serious diseases, and by the time they take action, it is too late and they can easily lose their child. So it is important that we change this. So timely recognition of danger signs in children is so critical that it could change what happens in a child's life, and it could be just a few minutes what is a matter of life and death. So it is important that parents recognize these danger signs at the earliest time possible and take the necessary action, and not only taking the necessary action, but taking the necessary action appropriately and timely. So what is the red flag number one? One is difficulty in breathing. So when we are talking about difficulty in breathing in children, look for fast, shallow, or noisy breathing in a child. That is a serious sign. Look at the chest pulling in or flaring nostrils. When you see the nostrils of a child moving in and out, it means that that child is trying to struggle to get air in the nostrils. We call it nasal flaring. When you see that, then know that that child has serious difficult breathing. And when the child breathing is too fast, then know that that is a danger sign. If you see the lips of a child turning blue or the fingertips turning blue, that is a danger sign that that child is having serious problems with her oxygenation. So act fast. This could be pneumonia. This could be severe asthmatic attack or anything blocking the child's airway system. The second danger sign in a child is something we call lethargy. Lethargy is a child who is unresponsiveness. Usually when you do something to a child, like you try to twinkle for the child will open your eyes, the child will try to respond. But you see a child who is not responding to that, then if your child is not waking up easily, if your child is unusually drowsy or weak, if your child is not even able to breastfeed or take his feed, then that is a danger sign. That child is very sick. And if the child does not respond to your voice, that is a danger sign. So seek emergency care. This could be a brain infection, it could be severe dehydration, it could be serious infection, and you need to take action immediately. The red flag number 3, vomiting or persistent diarrhea. So if a child is persistently vomiting or the child has persistent diarrhea, then the danger of dehydration is real, and this is more so especially in infants. When we talk about infants, these are children below the age of 2 months, and their capacity, most of their body parts, almost like 90% of their body composition is water. So when a child less than 2 months loses water, is vomiting or has diarrhea, you need to take that child to the hospital the soonest as possible. So the child who is seriously dehydrated will have sunken eyes, will have a dry mouth, when you try to pinch the skin on the abdominal part of the body, the skin will take a long time to get back. If the child is crying, he has no tears. That is a sign of serious dehydration. So take that child to the hospital. You can start the child on ORS. Any child of any age can take ORS without any danger, and we need to have ORS. If we have small children in our homes, have ORS always. It will save a child's life. So, and when you see these signs, the child is also not passing urine for some time, then you need to be worried about that child's life. Then the red flag number 4, a child who has seizures. What are seizures? These are jerky movements that affect the child's heart, the legs, can move the eyes, can move the mouth. Then you know that this child is conversing. And a child who is having conversions, that is a danger sign. You could see the child having the movements of the heart, the lips, the eyes, the rolling of the eyes, or loss of consciousness. That is a conversion. That child needs to get to the hospital the soonest possible. Time with the seizure, seek help immediately. It could be fever related, or it could be electrolyte related, or it could be a serious infection. So the red flag number 5, a child who has persistently high fever, and especially if this is happening under 3 months. So fever in a newborn is always an emergency, because this can cause serious harm to the child's brain. It can cause dangers to the child's brain. So see that this child gets to the hospital the soonest possible. And for toddlers, those who between the ages of 1 year to 3 years, if the fever is persistently high for more than 48 hours, despite giving a drug for fever, then take that child to the hospital. If the child develops a rash that spreads or doesn't fade, that purplish rash that doesn't blanch, doesn't go away, could be a sign of meningococcal infection, which is a bacterial infection, or it could be a serious signs of serious infection. So take that child to the hospital. If the child has difficulty swallowing or is drooling saliva, and especially this is accompanied with fever, is accompanied with a swollen neck, the child is refusing food or fluids, then that is a sign that that child is very sick, needs emergency care. So this could be from tonsillitis, could be blockage to the epiglottis, or it could be an allergic reaction that is making this child behave like that. So if the child has a sudden limp or has a refusal to walk from any reason, this could be a joint infection, it could be a fracture, it could be a neurological issues. And remember that fractures in children do not present in the obvious way that you may just see the rib is bent. Like if it's hard, it might not break like the way adults break that you see. The child the limb could just look bent. If it's a leg, could look bent, and the child is walking with a limping gait. And it could take some time, even when you go to hospital. If you're not very careful, you may miss a fracture in a child, and they need to be corrected before they cause harm. So what do you do if you notice any of these signs? 1, stay calm and know how to act quickly. Call the emergency services. And I have said in one of my previous talks, you need to have an emergency number. You need to know the number to the hospital near where you live, so that when you have an emergency, you know where to get help. And for more tips on how to deal with emergencies, I request you that you subscribe to the Overall Health YouTube channel for more tips on children's health, so that you can get more informed. And you can also follow us on more of the social media handles and be well informed. So call the emergency. Don't wait to see if it passes. You better go to the hospital. You are reassured, and remember that time matters so much for children, and every minute counts. So have a handy emergency list contact always, so that you can find where to go when you have an emergency. So early action saves lives. If your instinct tells you things are not good, Do not doubt your gut. So your awareness of a child danger signs is your emergency, is your first emergency defense. So save this presentation, share with other parents, and also subscribe for other tips. And also subscribe to the overall YouTube channel for more life-saving insights. Drop a comment below this video if you have experienced any of these. Your story might help someone else. And let's know what you have been doing when you have emergencies. We need to build a response system for the emergency signs in children so that all of us are aware and we make sure that our children are healthy and they have the care that they need appropriately and timely. Thank you for watching. Remember to subscribe, share, and comment. Thank you for watching. We meet in the next video.